Anita Souza. Dr. Souza is a clinical associate professor at the University of Washington School of Nursing in the Department of Biobehavioral Nursing. Dr. Souza earned her PhD in nursing from the University of Washington in 2016. She brings over 20 years of experience to the field. And so we're just so excited to have her with us today. And with that, I am going to turn it over to Dr. Souza.
Thank you so much, Andrew. All right, I'll take a moment here to adjust my screen so that we can begin our presentation. Hold on a moment while I do that. All right. Andrew, it looks like we have somebody waiting in the waiting room. Shall I go ahead and admit them?
Yes, please. That would be great. Thank you.
All right. Excellent. Hopefully everyone can see me okay here or see my slide set. Please let Andrew know in the comments if you cannot or if you have any trouble. I'm going to go ahead and actually turn off my camera so that I can focus on my slides in this presentation, but please know I'm right with you here. All right, so we're going to talk about re-examining our approach to care transitions. And I'll start off before I get into the objectives, just thanking Era Living for inviting me to this presentation. It's a fantastic coming home, actually, for me. I started my career back in 1995 at an Era Living facility at Ida Culver Broadview. And it was there that I fell in love with geriatrics and fell in love with how people adapt to their environments, and led to a career in aging, and specifically a focus on memory loss. So thank you to the team for having me back. So what we're going to talk today about is transitions. We're going to focus on transitions from living at home to living in an assisted living facility. We're going to talk about the impacts of memory loss and touch on the therapeutic approaches and why those are so valuable for individuals. So assisted living has really flourished in the last 20 years, and it's been great to see that. Initially, assisted living, what it offered was a home-like environment with a loose structure of support. And it's been really exciting to see how this environment has developed into an incredibly nuanced approach that helps to maximize independence and living well for individuals. Assisted living, when done really well, integrates evidence-based practices to help people with their aging process, but also to thrive with the aging process. So some quick facts: there's over 800,000 individuals nationwide that live in assisted living. And 50% of those residents are in Washington, are over the age of 85. And in Washington state, over 50% of residents have a memory loss disorder when they enter into assisted living. Okay. So assisted living is a significant move for an individual, and really simply stated, it is not just a move from point A to point B. So as this picture shows, there's a space between these two pictures. So what we see on the left is a young couple, perhaps looking at their house and moving in for the first time. And then later on, we see this transition to an assisted living facility. But what's not there is the space in between, and that is where life is. And what that might look like is 50 years of marriage, kids, moves cross country, travel, all of these memories that we have and that we take with us. And in nearly all cases for individuals who move into assisted living, there's some level of health concern. And one of the most significant ones that we'll talk about is memory loss. And it's hard to overstate the impact of a move for all individuals. And it's certainly not to discount or second guess the choice to move in. In most cases, it's entirely the right thing to do. It's just that we need to realize and appreciate the challenges of this transition and make steps to make it an easier transition for individuals. Okay, so hang on with me a little bit. I love a good metaphor, and I'm going to be using the metaphor of travel. So as we prepare for a move, we have a lifetime of memories that we've packed, and it's baggage that we carry. And I have to say that in the most positive way, it's the baggage that we carry. The reason and timing for a move is incredibly personal, and it often encompasses a real desire to augment or bolster an individual with supports, either through help with daily activities, through safety concerns that they may have, or increasing social and peer support through that social engagement process. Assisted living is uniquely designed to meet these needs through their programming and services. And what often comes up as we look at these options is the question of memory support. And when is the right time to move a loved one into this level of care? So I don't want you to get too hung up in looking at this slide. I'm going to go ahead and break it down a little bit for us here, but it is important to highlight. So research in this area has long been guided by a theoretical framework by a gerontological researcher named Dr. Powell Lawton. And what it is it encompasses a person-environment fit. So as you're thinking about either moving your parents or yourself into an assisted living, you're actually utilizing this framework as you work through these decisions. And I'm going to tell you a little bit how that works. So on the y-axis here, we have competence. So competence is the ability to meet the demands of our environment or our living situation. And in this graph, it's measured from low to high levels of competence. And on the x-axis, we have the environmental press. And this is measured from weak to strong. And these are the demands of our environment. And so to live in our daily environment, that environment needs to match our competency. And our competency in mastering an environment goes hand in hand with our ability to adapt. As we age, and if memory problems are present, we have trouble adapting to that environment. So the sweet spot that we are really looking for here is when we're not overwhelmed with the demands of our environment. And when the environment is a fit for our needs, we can flourish. And that's what we see here with those two blue areas, the zone of maximum comfort and the zone of maximal performance and potential. Okay. So not to get too in the weeds with this, let me give an example. So a simple example is the home environment. So if an individual is living, say, rurally in a two-story home, this is their physical environment. And the personal level factors that they bring to this is that they're diabetic and they have limited mobility, okay? So you have an individual living rurally in a two-story home who's diabetic with limited mobility. Independently, their needs are going to be really hard for them to meet and increasingly difficult for them to meet. They need support. And so enter into the supportive environment of assisted living. When the environment is not pressing on them for independent demands, they're able to flourish. So in assisted living, if they're offered support in mobility, support in meal preparation, they get to that adaptation level and feel supported and actually thrive. Okay. And So the key to this is successful adaptation, and adaptation requires personal ability to engage in that adaptation process. And that is hard if there is a memory loss disorder. Okay, so we're going to talk about that a little bit more by taking a step back and talking about dementia and diving into memory loss disorders a bit and how that impacts living choices. Okay, so dementia itself is an umbrella term, and it encompasses all of the symptoms of memory loss. And we often break it down into 3 categories. So progressive memory loss, non-progressive, and reversible. So progressive memory loss disorders are over there on the left, and you'll see Alzheimer's disease is the first one listed. It is the most common, but there are other ones there as well. And the key here is that progressive memory loss disorders will continue to progress independent of the environment in which an individual lives. So it is a disease that is going to continue to march on and progress, right? But that is not to say that the environment doesn't play a critical role. In fact, it plays one of the most critical roles for an individual. As an individual with memory loss, they will continue to lose the ability to adapt to their environment. And so that is no longer an expectation. The expectation is that we adapt the environment to them. And it's not a casual adaptation. These are essentially therapeutic interventions for individuals. So I look on the other side of this graph and we talk about reversible symptoms of memory loss or dementia. And I'll bring up one example. So depression and anxiety. Maybe an individual was at home and they were starting to show signs of memory loss, but there was also some depression and anxiety that was at the forefront of that. But when they moved into assisted living, because their needs were being met and they were able to adapt to these changes, the depression and the anxiety were reduced, and you no longer had acute issues with memory. And so that's a different situation than the progressive memory loss. Okay, so what is impacted by memory loss? What is impacted by memory loss is a couple of key areas here, is executive functioning, your different components of memory, as well as communication issues. So in daily life and executive functioning, this is so critical to our everyday functioning. Executive functioning is how we plan, how we set and manage goals. So think about every interaction that you have in your day. It's about setting a goal and then thinking about how you're going to accomplish that goal throughout the day, whether it be making a meal, going to a doctor's appointment. Any of those things have multiple steps that are involved in them and rely on our executive functioning. Initiating action and anticipating consequences, again, it's a part of our executive functioning, and it's a challenge for individuals who are living alone in the community when memory loss becomes an issue. Regulating our actions and our responses is also key. Our working memory is how we get through the tasks of daily life and contribute to decision making. Okay. As well as reflection and self-evaluation of what is working well, where an individual might be running into challenges. Those are where we can self-reflect. But when memory loss is present and it's impacting our executive functioning, we're not able to do that. So in short, I think this picture sums it up. We have a goal, we have ourselves as an individual, and these are the puzzle pieces that we need to get to whatever our goal is. And those are impacted by memory loss. And it can be exacerbated in the home environment when individuals don't have the support, but it can also be a challenge when an individual moves into assisted living and maybe is not at a higher level of care that they need to maximize their living. So if they're living in traditional assisted living, but have not yet moved to memory care. So daily life, our memory plays a critical and important role in a couple of ways here. So we have short-term memory and our long-term memory. And oftentimes we use an analogy of a filing cabinet system. So everything that happens that gets stored and stamped as a memory is put into this filing cabinet system, right? And when we get to be 85 years old, we have a lot of memories and we have a lot of filing cabinets and we have complex structures of filing those within our brain. And those are our long-term memories. And in our short-term memory, things are stored for just, as it says, short-term memory, very short periods of time, and they're not cataloged well and set into that long-term memory function. And I think when I talk about short-term and long-term memory, a lot of folks bring up the challenges that they have in communicating with somebody with a memory loss disorder. And they say, I just don't understand. I don't understand how my husband can talk about things that happened 30 years ago in the greatest of detail, or he knows where we had something that we put away in the house and has always been in that place. And he always knows that because that was stored in his long-term memory. Your short-term memory is that he can't remember what you told him you were going to be doing today at breakfast. And these were the plans for today. Those sit in an individual's short-term memory. And it's often the most frustrating part for caregivers and for the individual with memory loss as well. And so think about daily life and memory in the context of making a move to assisted living for an individual with memory loss. You're disrupting a lot of their file folders in that move. So I think this here is a great example of where executive functioning and memory come into play. This is the mini Cog assessment. Some of you might recognize this. It is now a part of the Medicare annual wellness exam. What it looks like is a provider asks an individual to remember 3 words. And then they ask them to draw a clock and put the clock at 10 past 11. So over here on the left, these are the results. You can see that this individual remembered banana and clock, so they missed one of those words. And then this clock is not what we would typically see as a clock with the hands placed at 10 past 11. So what this shows us when there's a clock that is not drawn correctly is that this individual is struggling with some areas of executive function in organizing and structuring the information. And this is always a valuable tool when I'm talking with families who maybe don't know what's going on at home for an individual, and they're trying to make a decision about whether or not this is the right time to move or not. Well, this clock tells us a lot about what might be happening behind closed doors, because if this individual is not able to draw the clock, put it at 10 past 11, it starts us kind of wondering what else is happening. Is that individual able to organize their medications? Are they able to plan a meal for themselves? What is happening behind those closed doors that are maybe not allowing them to function the way that they need to live healthy? Another area that is often a challenge with memory loss is in communication. And this is a way that we connect with others, right? So there's so many implications to having challenges with communication. And some ways that we see this brought to the forefront is difficulty with initiating interactions with individuals, following conversations, and maintaining focus. And again, sometimes these come acutely into focus when an individual needs to make a move or after they've made a move to assisted living. And I think about this in the dining room interactions that I've seen. When an individual is in the dining room, and if they have a memory loss disorder, they're pulling on every facet to communicate and to follow conversations. And because they might have a disease process working behind the scenes there, they're really having trouble. They're having trouble initiating that interaction with their fellow peers. They're not able to follow those conversations because there's a component of short-term memory that is at play in those conversations. And ultimately, this leads to them having an inability to maintain the focus. And it is often apparent to individuals around them this is happening. And I think sometimes people forget that the individual themselves has an awareness of this deficit and this memory loss challenge themselves. And what we see is that individuals start to pull back, they start not to engage, and they start not to communicate with those around them. And that's a significant trigger to us as professionals to say, hey, we need to look at something different here for this individual so that they can then thrive in an environment. Making a move often challenges us as the family members, as the care providers, as a spouse to unpack some things. And sometimes unpacking the feelings and the emotions around a move are the hardest. So let's go ahead and unpack a couple of these most common ones. So number one can be a really hard one, and I've often had this conversation with families. And it goes something like this. I promised I would never. And sometimes this is based on conversations that happened between mom and dad and adult children many years ago. Sometimes it happened between a spouse. And it's a very hard thing to grapple with because you made a promise without the knowledge that you have today about mom and dad's functioning and the supports that might be necessary for them. And sometimes what comes into the back of folks' mind is that I told them I would never put them in a locked facility, and that locked facility permeates their thoughts, and it's really hard to set aside. So we're going to talk a bit in a bit about how giving ourselves some grace to look at what is the therapeutic environment, and it's often very different than those initial impressions that we had. And we often would have made a different choice for mom and dad. We wouldn't have said never, right? Okay. The other is, how about a little bit more help? So when an individual has moved into traditional assisted living and it becomes apparent that it's just not working and that their memory loss is becoming an issue for their functioning in assisted living, we start to bargain and we say, well, what if we just brought in a little bit more help in their standard assisted living prior to moving them to memory care? And I hesitate with that one because when an individual, this is a dramatic example, but when an individual has a stroke and they have difficulty with mobility, what do we provide? We provide an aid. We provide a therapeutic aid to help them maximize their living. And that's a cane, that's a walker. The therapeutic aid for the invisibleness that is memory loss, right? It's invisible because it's not always transparent on the outside, but the aid is the environment. So I encourage folks to make a decision earlier rather than later about moving somebody, and not to put a Band-Aid on it temporarily to have them just stay in standard living. I encourage individuals to be early adopters of memory care because I think it works out best for the individual. You're providing them that therapeutic intervention early. And that goes along with he or she is not ready. And I think this one can be extremely challenging because you're looking for the person to be in agreement with what you are seeing their needs to be. And honestly, sometimes that doesn't happen. And so this is where you really rely on the assisted living facility to provide you a little guidance and fall back on their providers to support you in that transition and to support the individual in that transition to make sure that they are settled and that this is a good fit for them. Let's wait, right? So when we get to a point where we're not sure what we're going to do and how we're going to make a decision, sometimes we just wait on it, right? So let's talk about what the impact of waiting on that is. So this is a study, Dementia and Transitioning from Assisted Living to Memory Care Units, perspective of administrators in 3 facility types. Making the move to memory care. These are 4 areas that administrators were struggling with in the move, talking with families about the move, right? So this is what happens in that wait scenario. Let's wait and see. We run into wandering and elopement issues. So an individual who's going outside of the facility, and that often leads to some very dangerous situations for individuals when they've left the facility. Behavioral and safety issues, maybe there's some acting out of behaviors, and oftentimes those acting out and the wandering behaviors comes from the person being stressed by their environment and not having the skills to deal with the environment that's presented in front of them. Can think about some of the main levels of assisted living where there's just seating areas. And if there's a lot going on in that particular area, it's actually really hard for the individual with memory loss to cope with all of the different dynamics that are happening in that situation. So it's easier to go outside. It's a very practical response, but it's one that's met with concern when the individual has memory loss because it really is about safety for them at that point. Okay. And so there's also a real concern around increasing care needs and that those care needs are not being met. So our activities of daily living, so cleaning, bathing, those sorts of things. Those are increased care needs that an individual with memory loss is not able to meet those demands. And difficulty socializing, all for those reasons that we talked about before, is that those dynamic changing situations that happen in conversations and get-togethers are really hard for an individual with memory loss to track and participate in. And so the result is that they pull back, and that is at an impact to them. So in total, all of this comes back to individuals really struggling to engage in their environment. Okay, so this is the part of the presentation where I need a little active participation from you. So what do you see here?
I'll say, I see a man with a wreath on his head.
Great. Can you describe that man?
I would say he is an older man with a beard.
Great.
He's squinting.
Any other thoughts from folks? All right, so Andrew, you're right. It's at the forefront what we're seeing when we look at him. We're seeing an old man, perhaps a little bit of a disheveled man, right? Okay. It's all about our perspective. Now, if you can see that red line that I've put around, sorry. So you can see that red line. On the left is a man, and on the right is a woman, and they're engaged in a kiss and an embrace. Are folks seeing that?
I'll go ahead and say from our office, mind blown.
Right? I'm glad you used that term mind-blowing, because I think that's what happens when we change our perspective when we're looking at individuals with dementia, and we change our approach to thinking about the environment that they're in, and that we need to maximize their potential, so that we're then focusing on who they are as a person, their life events that made them who they are, rather than the old disheveled man that we were seeing in the initial slide. Does that resonate with some of you? So we look at that new lens, and so what I'm about to say might seem a little bit odd, but when memory care is done really well, memory problems become less the focus of care, and what rises to the surface is actually the whole person. And in memory care, you're no longer identified by your disabilities or your deficits, but by your abilities. And that is where it is really whole person care that people experience when they actually make the move to memory care, and when they think about memory care earlier in the process rather than later in the process. I used to describe it as moving to the head of the class, because families would not want to make that move. And I would say, you know, if you could have a different environment, an environment where an individual was set up to thrive, would you choose that? That is moving them to the head of the class. So again, in whole person care, in memory care, it's not a concern that Frank wants to play bingo but doesn't remember what time it is, or loses attention and can't stay for the whole session. What happens in memory care is that Frank gets to be Frank, and his environment and the staffing structure that underpin that is there to make it a failure-free experience for Frank. And he's going to see increased engagement, and that's going to happen through the staff approach. And I'm so pleased Era Living uses the best friends approach, and it's a fantastic evidence-based approach. And so that's where you can rely on the staff to be supporting your loved one's needs. And peer interactions. It's so amazing to be in a memory care unit and see the peer interactions that happen with individuals. It's again, no longer about the deficits. Somebody might lose their track as they're having a conversation. It's not an issue in memory care. Nobody's going to bring that up as a disability, where it is brought up as a disability and a disadvantage in other settings that are not memory care focused. And there's a structure that underlies that, a structure for the day, a structure in the environment that helps them with some of those executive functioning pieces that we talked about earlier. the planning, having a rhythm to your day, those things start to go away when you have memory loss. And so what memory care does is it institutes those and provides those levels of support for individuals. Okay, so what I want to go through is those components that we saw in that study, where they saw that these were the 4 areas of concern that administrators saw, and how when we layer on a therapeutic approach in memory care, those are no longer areas of concern or worry. So the memory care environment, wandering and elopement, okay? So again, a little bit of an optical illusion. What are folks seeing here? And I'll tell you a trick about Zoom. I think if you press your space bar, it can temporarily unmute you. Andrew, would you be able to unmute folks so we could have some participation?
I see a library at the end of
Absolutely.
a hallway or in a corner of a room.
Excellent. What do other folks see?
A library, but slightly different from the one on the left to the one on the right, but a lot of similarities.
Yeah, so what would you be expecting as you're coming up to this library?
Well, I see a space in the middle of the 2 bookcases. So does one of them swing or do they move?
Right? Wonderful curiosity, right? But you're still seeing it as a bookcase. And this is the therapeutic approach. What actually is here is a door, and it's a pair of double doors.
Right.
Right? Ethan?
It's actually a door that you would see in a memory care unit.
Exactly, exactly. This is, and it is a therapeutic approach, because what happens to doors? Doors are what we exit out of, and it creates an opportunity for that wandering and that elopement to happen. And it's just natural, right? If we come up to a door, we're going to open that door and we're going to walk through it, right? But here, the visual illusion in this space says, that's not an exit point. I'm going to turn around and I'm going to keep walking, and I'm not going to walk through that door, but that's where I would get a book if I want to, right? And it creates this safe environment for individuals.
Me too.
Okay, so the memory care environment for behavioral and safety needs. When an individual was either at home or in standard assisted living without a memory care component, going outside, we find that it gets reduced. It's not an opportunity that they have, but it's an opportunity that we all need to be out in fresh air, to be socializing, to be engaging. And what happens in this environment is that there's a fence, and there's areas where people can congregate safely, but there's not wide open spaces where an elopement is going to happen and somebody is going to leave. This is just a safe environment. And I should say, all of these pictures were taken from Air Living as well. So fantastic examples of creating a safe space for an individual to thrive, where there's no longer concern about their competency to be in this environment. They're entirely competent to be in this environment, and the demands of the environment are not going to override what their capabilities are. And I think this picture is one of my favorites, because it's a great example of the constellation of design elements that come together to create a therapeutic environment to increase care needs for an individual. So they're unobtrusive, home-like elements, and they're evidence-based to provide optimal support for someone with memory loss issues. So a couple of the highlights here is the carpet. This is not a mistake with this carpet. The carpet has clear borders that create visual structure that help the individuals with memory loss. The moldings, while beautiful and a decorative accent, they also help as a natural support for individuals to maximize walking and mobility. And the memory boxes outside of the rooms, they help to provide wayfinding support. But I think another piece that folks forget about these boxes, these memory boxes, is they also create insight into the individual so that staff can then engage your loved ones in important discussions about what's happened in that individual's life and get to know them. And those are things that are in the staff member's toolbox as they're interacting with your loved one throughout the day. And there's plenty of light in this situation, plenty of places for an individual to stop and take a rest. And most importantly, there's really no wrong direction here for an individual to go. So great example of a memory care unit that's taking a therapeutic approach. Okay, this one makes me smile. I'm happy to see folks so engaged. The therapeutic approach here is a therapeutic approach to socializing. And gone are the days when individuals were not socialized, when we didn't have activity structures. Now we know the importance of that. We know the importance of failure-free activities as well. And this is the richness and where memory care thrives in engaging individuals. And no one is going to feel excluded in this example. People are going to want to join as their capabilities allow them. So I hope as we've talked this through and had a little walkthrough of what a memory care unit looks like, I hope I've given you a little bit of insight and some skills to engage in a therapeutic lens when you're looking at decisions around assisted living and memory care. And think about making those decisions earlier rather than later when it maximizes potential for individuals. And when we look with a therapeutic lens, we are also destigmatizing the move to memory care. Memory care tends to be very stigmatizing in certain situations. And I think one of the ways that I see that we can help individuals with that is when we go to a memory care unit to visit mom or dad, do we take mom or dad out of memory care unit to go maybe have lunch in another part of the facility? And is the reason for separating in that way because we're a little uncomfortable with the environment ourselves? One thing that can be beneficial is for us to actually stay in the memory care setting and engage with them and see what they see and meet the people that they're around daily. Those are things that help to destigmatize those experiences. And again, engage with staff. Staff is your best ally in all of these transitions, and leaning on them to provide support to get to know your loved one, what works well, what doesn't work well, what time of day to visit, when are they having challenges. So really relying on them because they are the eyes and ears of what's happening in that unit at that time. And be kind and graceful with yourself and expect a transition time, both for yourself and getting used to this move for your loved one to be in memory care, and also for them themselves as they move into memory care. All right. So I wanted to make sure that here's my contact information. I know that Zoom is not always the best platform, and some folks have a hard time engaging in back and forth and questions and conversations. So please feel free to email me or give me a call, and I'm happy to talk things through. But I'm wondering if we can open up the floor and have some questions.
Absolutely. This is a great time. Anyone that does have questions that would like Dr. Souza to answer, this is a fantastic time to go ahead and do that.
The Sturgeons have no questions. We found it very interesting. And it was explained well.
Thank you so much, Joe.
Thank you.
Can I ask a question that you had? There was the graph with the X and the Y axis and someone's memory and how that was, you know, how different times in the move can impact different things. Are there sometimes different metrics that you can use that you would maybe place people in a certain area of that graph? We're just weighing some pros and cons for my mother, and I just wanted to kind of see what your perspective might have been on that.
So can you tell me a little bit more about what you're experiencing for your mom? Would you be willing to share that with the group a little bit?
No, certainly. She has early onset, so it's a bit complicated with her case because she's physically pretty strong. So we are wanting to make sure that she has the physical, you know, opportunities, and with COVID, it makes it a bit more complicated. And so we're trying to weigh the pros and cons where she can still take care of herself right now, except like she just needs her caretakers that are at the house with her, help her for showering on a regular basis, but she still goes to the bathroom okay on her own. So there's things like that. And she certainly has had, you know, the MOCA test and all those things and everything. So we're trying to get a metric. And so I'm just kind of curious how, you know, as I learn more and more about this, you know, personalities can also impact how someone could or could not respond. But I was just wondering if there's kind of just an average of where you would put certain scores in that transition for where they can embrace it more or less.
Yeah, so it's not a particular score that an individual gets that says, okay, it's now time to make the move for this individual, right? And I think that's always the hard piece, is that right now what you're doing is absolutely correct, because you're taking and you're bringing in different supports where you see that she needs those supports, right? And so you continue to augment those, right? But if she was to move into a memory care, some of those issues and the environmental press would go away. Like the stressors in the environment would go away, and the memory issues would not be at the foreground as much, and her deficits would not be as much, because she would be allowed to just be and flourish in the environment.
Yeah.
You know, and I think it's a hard place to be, because it's taking a big step, right? It's taking a big step and a leap, but you're not taking it alone. You're taking it with support from folks at the facility that are going to make this transition happen for your mom.
Okay, thank you.
Does that help a bit?
Yeah, no, just we're trying to, you know, there's so many things that influence these decisions, so just trying to weigh a lot of pieces together. So thank you.
There's so many pieces to weigh. Yeah. Lee?
Yes, I have a sister-in-law that she's been diagnosed with Alzheimer's, and that was more than 10 years ago. And but she's been on meds, and she's got a very slow decline, fortunately. I have not seen her in 7 months because of the COVID, but she's been isolated during that time. Her husband is convinced that he's going to take care of her. And we've been trying to get him to see that there are better solutions. Let's put it that way. My fear is, what happens if something drastic happens to him and she is left alone and the children need to find a place for her? Now that's extreme, but that's what we're dealing with.
Well, Lee, it's actually not, I mean, it's extreme. Yes, it's extreme, but it's not out of the ordinary, unfortunately, from what we see happen in the community, that people delay the decision to make the move because the primary caregiver wants to be that support, right?
Right.
They want to be that support. They're concerned what will happen if I'm not in that role anymore for that individual. Caregiving has a cost to it for the individual that's caring, right?
Oh, absolutely.
It has a health,
Absolutely.
it has health implications, and it doesn't matter if it's the direct family caregiver or it's the daughter making decisions about this. This has implications for that individual. And we've seen some pretty tragic experiences where someone has delayed that move and that individual who was the primary caregiver passes away.
Yes.
Right? And you've missed an opportunity for that person to help the transition be successful.
Right.
So that husband could help that transition be a successful one for that individual, right? And there's also, I think, helpful to talk about a realignment of the relationships that happen with that. So in that situation, it's pretty dramatic and relieving for a lot of folks once they make that move, that they then get to be the husband again.
Yes.
They get to be the husband. They get to be the daughter. They don't get to be the primary caregiver all the time. Does that help a little bit, Lee?
Well, a little bit, but you know, we're concerned, but we're not one of their children. My husband is a brother, so it's just, you know, but we're watching it and we're seeing what could be a very unpleasant set of circumstances that they are going to have to face.
Yes.
And I want to be helpful in some way.
And the way that you are being helpful is that you want to see him continue in his role to be an advocate for his wife and helping him to see that that is a very important role. And it does not go away with a transition to assisted living and memory care.
Thank you.
Mm-hmm.
All right, as we get ready to wrap up, I'll throw out one more opportunity for some questions. Okay, if we have no other questions, I think we're just about ready to wrap up. Dr. Souza, I appreciate your time so much today and the information that you shared. I think it's so valuable and vital for families. So thank you so much for that and for being with us today. Again, thank you to all of our participants. If you or a loved one are interested in learning about independent, assisted, or memory care living here at the Gardens at Town Square, we would love to hear from you. You all have our information, and we're here to help any way we can. So with that, I will go ahead and end the presentation. And again, I thank you all for joining.
Thank you.
Thank you. Thank you very much.
Thank you.
Thank you.